Hi, everyone. For those who do not know me, my name is Marie Magalan Cueto. I'm the Communications and Community Engagement Coordinator of the Coalition. This session is very important to us because it's with one of our amazing initiatives that we do since 2022, which is the Bladder Cancer Awareness Month grants. So as I mentioned, we started in 2022, and it helps strengthen bladder cancer awareness and patient advocacy in low and middle income countries. So thanks to these grants, we have organizations that have been able to organize awareness events. They have trained volunteers. They have created amazing things such as educational materials. They've even partnered with some sport clubs, etc. So you'll hear today from 4 recent awardees who made a real difference in their projects. So as I mentioned before, for those who were not in the room, one of the speakers is going to make the presentation in Spanish. So if you can connect to Wordly to understand the presentation, that would be amazing. And let me invite now Wisdom, who is the Director of Programs at One Community in Malawi, Fiorella Gagliardi, who is the President of Vicari GU in Argentina, Óscar Rodríguez, who is the founder of Fundación Proyecto Cáncer in Colombia, and Charles Ogada will join us online, and he's the team manager for Desert Scorpions. And thank you all for being here today. Thank you for the amazing work you've been doing. And now let's hear the first presentation. Wisdom, the floor is yours.
Thank you so much. Hi, everyone. I'm Wisdom Nyirenda from Malawi, representing One Community. And let me start by introducing what is One Community. It's an institution that is based in Malawi. It's a local non-government organization working on a different governance, healthy, education, as well as agricultural sector. Today it's a privilege to be present among you and share what we have done in Malawi based on the grant that we were awarded in 2024. My presentation layout probably will focus much on the Become Grant, success and lesson that we have learned, but also the way forward, and probably, if anything, we'll take some questions from the audience. One Community, like I said, it's a local non-government organization which is based in Malawi. We implement programs at national level, and based on the criteria that we were part and parcel of World Bladder Cancer Coalition, but also awarded a grant in 2024. We implemented a quite number of activities that we focused much on providing the knowledge, but also creating a demand among the community members in terms of knowledge, but also other elements. So our interventions in most cases, I think we're focused on the this circle that we are focused. Specifically, our interest was to provide the information and knowledge to the community. We managed to conduct a capacity building training, which was the key element to the our community, but also to the volunteers that we work with. Why? Because in Malawi, I think there's a gap in terms of what is there, but also what is missing on the issue of bladder cancer. there are quite a number of, so to say, the information that is missing among the citizen. One of it is lack of knowledge in understanding what bladder cancer is all about, but also at the same time looking at the literacy level among the citizen. So for us, our keen interest was to provide the knowledge based on the information that we got from the World Bladder Cancer Coalition members and the entire bladder cancer community. By providing that information, we were able to reach out to the rural masses, including the training of over 120 plus members. That's our volunteer structure, and that volunteer structure is based at community level, led by what we call volunteer lead or lead volunteers. So for us, I think apart from that, we were able to also establish a patient a group which support but also facilitate the different conversation as well as engaging members at community level. So the picture you're seeing before you, they're one of the trainings, but also information sharing. To my right-hand side on this, those were some of the groups. Those, the ones in reflectors, they were part and parcel of lead volunteers that were providing training to the community members. After we provided those trainings, some of the lead volunteers, they were able to take that knowledge to different members group, but also create the awareness to the communities. So in your picture that you're seeing, those are the training of trainers, as well as the community awareness campaign, which was conducted in 2 different regions. That's Lilongwe, as well as the northern part of Malawi. The picture that you're seeing, one of them is the awareness activity, but one of it, the one with 3 members, it was the what we call a door-to-door campaign. In our local language, we call it Nchembeleza Ndonda. What it means simply means taking the messages to the individual families so that they are aware, or we establish whether they understand the issues of bladder cancer and other related diseases. And quite interesting fact was that these are the very same element that we discovered that a lot of community members, they are not aware of bladder cancer, as well as even the signs and symptoms of bladder cancer, to be precise. So these are the same activities that has created the opportunities to provide the information to the community members in Malawi. Some of the group members or the patient forum that were formed, they were discussing but also sharing their plans, and after they discuss as well as share the plans, they share with us at the office, and we include them in other trainings, but also in other activities that we fit we can provide to them. I should be specifically mentioning that regardless that the award or the amount that we got was little, but trust me, it was the same amount that has made a huge difference, because as we speak, we reached out to almost over 300 and something community members as citizens in general in Malawi. Why I'm saying that? Because the awareness activities were divided among the volunteer structures, and we have got a huge number of volunteer structures which are community-based. We are talking of a pool of 200 plus volunteers through 20 to 50 lead volunteers who are lead such type of volunteer structures. And we also created some of the awareness campaign materials. Not only that, we also had the opportunity to engage the media in helping us to disseminate the information and create the awareness. So in a nutshell, this is what we did, but also managed to achieve with the support that we got from World Bladder Cancer Coalition. And I should be grateful because the time we were applying for the opportunity, we thought maybe we may not make a huge difference, but surprisingly, it was the same process that has managed, but also even create more opportunities for some of communities in Malawi. As we mentioned, as I was mentioning that the demand that was there, I think some of the community were able to follow up through the phone calls, but also not only the phone calls, even visiting our offices and engaging the volunteer structure at community levels in terms of what would be the best way forward in getting the information and all that. So some of the information we thought, we created a hotline so that they can get some tips, but also even refer them to the relevant authorities, because for us, our focus is non-biomedical interventions, because we are not professionals in this field. For us, I think we are just an advocacy institution that focus on non-biomedical activities. And thank you so much for your attention, but also for listening. And over to you, Mary.
Thank you so much, Wisdom. Thank you so much for such a great presentation, and it's amazing all the things that you've been doing in Malawi. You can be very proud. Now I'm going to give the floor to Fiorella. As I mentioned before, it's going to be in Spanish, so for those who have not scanned yet or do not have access, you can scan the QR code now. And Fiorella, the floor is yours.
Hola a todos, mi nombre es Fiorella Gagliardi, soy presidente de VICAR-EGU, es la primera asociación argentina y latinoamericana dedicada al cáncer, específicamente genitourinario. Antes que nada, quiero decir que es un enorme honor haber sido incorporada este año al directorio de la coalición y espero realmente estar a la altura de este espacio tan importante. También quiero pedir disculpas por no poder hacer esta presentación en inglés, pero quiero asegurarme de que el mensaje llegue claro. Para mí es un inmenso orgullo estar acá en el Foro Mundial de Pacientes con Cáncer de Vejiga, trayendo la voz de los pacientes desde Argentina. Antes de contarles lo que la asociación, quiero poner en contexto la realidad de esta enfermedad en nuestra región. En América Latina, cada año se diagnostican 28.000 nuevos casos de cáncer de vejiga y lamentablemente más de 12.000 personas fallecen a causa de la enfermedad. En Argentina, según el Instituto Nacional del Cáncer, se registran alrededor de 3.000 nuevos casos al año. Y aunque es más frecuente en hombres, también impacta profundamente a mujeres, sobre todo por los retrasos en el diagnóstico. Pero estos números no son solo estadísticas, son rostros, historias, familias y emociones. Por eso, en Vicare, creemos profundamente que la información y la concientización salva vidas. Desde nuestra organización tratamos de visibilizar el cáncer de vejiga, acompañar emocionalmente al paciente y la familia y promover mejoras en políticas de salud. Hace 3 años conocimos a la World Bladder Cancer Patient Coalition y el año pasado tuvimos el honor de recibir una subvención que nos permitió concretar varios proyectos. Hoy quiero contarles qué hicimos con ellas. En primer lugar, organizamos el segundo Congreso Internacional Virtual de Pacientes con Cáncer de Vejiga. Lo transmitimos en plataforma de pacientes, una herramienta creada especialmente para los pacientes y las asociaciones. Allí reunimos a profesionales de distintas especialidades, porque si bien el oncólogo y el urólogo son fundamentales, también lo son la psicooncóloga, la nutricionista, el fisioterapeuta y muchos otros. Estamos convencidos de que el abordaje debe ser multidisciplinario, con un lenguaje claro, humano y comprensible para quienes atraviesan esta enfermedad. Creemos que el Congreso, cerramos el Congreso con nuestro clásico Yo puedo, vos podés. Es una entrevista de paciente a paciente, donde comparten cómo se sintieron con el diagnóstico, el tratamiento y el proceso de recuperación. Es un momento muy valioso porque una palabra de alguien que ya transitó ese camino puede empatizar y vale mucho más que folletos. Eso es lo que tratamos de sostener cada día en nuestra red, acompañar desde la empatía y la experiencia real. Sabemos que muchas personas todavía no se animan a hablar del diagnóstico, incluso lo esconden por el estigma que existe. Pero esto de la virtualidad es clave. Nos permitió llegar a pacientes, brindar un espacio seguro y demostrar que no están solos. Otra de las actividades que realizamos con la subvención y que ya se volvió un clásico es la caminata consciente coordinada con la licenciada Nancy Ferro. Es psicooncóloga y especialista en mindfulness. La realizamos en el lago de Palermo. Hoy hacemos 2 caminatas al año, en la costa de Vicente López frente al Río de la Plata. Cada encuentro reúne a más personas que descubren el bienestar físico y emocional que genera el simple hecho de respirar, moverse en forma consciente y sentirse acompañado. También llevamos adelante campañas en redes sociales y hospitales repartiendo material informativo para que más gente nos conozca y conozca los síntomas, los factores de riesgo y la importancia de la detección temprana. Y todo esto fue posible gracias al apoyo recibido por la coalición. Estar en red y formar parte de la Coalición Mundial de Pacientes de Cáncer de Vejiga nos dio la fuerza y respaldo y sentido de pertenencia. Nos permite aprender de otras asociaciones, compartir experiencias, inspirarnos mutuamente y sentir que no estamos solos en esta lucha. Cuando los pacientes y las organizaciones trabajamos unidos, nuestras voces se amplifican, cruzan fronteras y logran cambios reales porque juntos somos más fuertes. Y esa fuerza colectiva es la que hoy nos impulsa a seguir adelante, acompañando, visibilizando, transformando realidades. Quiero cerrar con una frase que siempre repito porque lo creo profundamente y lo veo en cada uno de los pacientes que acompañamos. La detección temprana salva vidas y se puede vivir dignamente con cáncer de vejiga, especialmente si se detecta a tiempo. Por eso es tan importante hablar del tema, romper el silencio, generar conciencia y como escuché ayer con un colega que dijo que hay que poner en agenda el cáncer de vejiga, porque cada vida que logramos acompañar vale todo mucho esfuerzo. Gracias a la coalición por su apoyo, por creer en nuestro trabajo, por ayudarnos a crecer y por permitir que la voz de los pacientes siga escuchándose en todo el mundo. Gracias por este espacio y por escucharme. Gracias de corazón.
Muchas gracias, Fiorella. And now the next person who's going to present is Óscar Rodríguez from Colombia.
Why are you laughing? Hi, how are you? My name is Óscar Rodríguez from Colombia, from Bogotá. I'm sorry, man. Hey, Theodoros, I'm sorry. Well, my voice is very high, so it's okay. It's very loud, high now, loud. Okay, this guy is Óscar Rodríguez, and this guy, too, is Óscar Rodríguez. This picture was before I known about the bladder cancer. In this picture, you can see this face. and you say, oh my God, this guy is really happy. And yes, of course, was really happy. And now, I'm really happy too because I am a survivor of bladder cancer. So give me a... It's amazing. I want to say special thanks to David and Laurent. Laurent is good pronunciation in French. Beautiful to Laurent. Because of them, actually, these two guys from Cambes, from Spain, connecting me with Alex and Marie for the first time. And after that, I'm here. The rest is history. And I'm here to give you the opportunity to know more about Colombia and bladder cancer in Colombia. It's not a common disease there. I think in a worldwide is not a common disease, but right now it's an increase, not only in Colombia, in all Latin America too. So this is my journey, and this journey gave me the opportunity to know more about me, because I had a lot of months of uncertainty, and at that point of time I thought, oh my God, I want to die, and that's it. When I discovered I had bladder cancer, but something inside me told me, don't worry, dude. I always been a very happy guy. I told you yesterday, one of my deepest secrets. I was cheerleader 20 years ago, yes. And the first thing that Anita says was, oh, you want those of these guys that... Yes, exactly. I was one of these guys. So all my life, I'm a very happy person. But sometimes, you know, these kind of things make the life not too good for sometimes. Okay. I want to ask you a favor. Please scan this code right now. Please, scan it. Thank you. And make a donation. I push you to make a donation. €1, €2, I don't care. €5, 500, 5,000, I don't know. Wherever your heart consider. But it's important to our fight. You know? So, please. This code is in all the slides, I think. I can't remember. But scanning, make a donation, support to us. Thank you very much. What our initiatives are educational content of prevention. We have a YouTube channel with different interviews with different patients, not only with bladder cancer. Every cancer is welcome to just talk and to say their history, their stories, because the most powerful weapon to have the people is to speak with others and talk the stories, and that's it. This is the most powerful weapon. So we have a YouTube channel to spread this knowledge with patients, not only with patients, with doctors too, and professionals of health that help us to discover more about bladder cancer and about different cancer disease. All these people, I think this slide give me the opportunity to feel very happy, because I start this project just on one thing: how can I help people? And I just thinking, oh my God, how can I help to people with bladder cancer and another cancer? Well, I start to do this kind of interviews. This girl, Liliana, was the first patient that gave me the opportunity to interview. So she told me everything about the effort and give me the possibility to understand why it's important to speak about our feelings. So when the interview finished, she asked me, hey, Oscar, give me a favor. Give me a big hug, because I feel amazing after that. So for me, it was amazing. And this interview gave me the possibility to understand I'm really good doing interviews with people, so I start to make a plan to reach the most people that I want. So she is a nurse, amazing nurse in Colombia, and her story is amazing. If you scan the next code, no, this one is for donate. Also, if you want to scan it again, okay, no problem. And what I learned, share your story, your experience can save lives, everybody. Support financially with fund prevention campaigns, spread the message, early detection is the key. I think this is the most important thing. And FUPROCER, connect foundations together, we are stronger. Together we can strengthen this fight and learning journey with cancer. Please scan this code. This is the YouTube channel. No, it's okay. This is the QR code to my YouTube channel, when you can watch all the interviews with different patients. It's in Spanish, but you can put subtitles in English to understand better. Okay? The name of this initiative is Proyecto Cáncer. Before I create the foundation, the Proyecto Cáncer was the YouTube channel to spread this knowledge about different cancers. And the Cancer Project Initiative, after that, the foundation starts. And this week, not the last week, I become a member of these amazing coalitions. A big clap, please, a big clap. Project Cancer Foundation is a reality right now, and my first task is, first of all, try to talk with you about this disease in Colombia. In Colombia, there is not a lot of companies or enterprise or doctors that speak about this. But my first task is try to spread all this knowledge of the coalition to the people in Colombia that want to learn about bladder cancer. Making these stories visible and generating awareness is the best way to do everything for everybody. I feel really happy to speak with you guys, to know you, and for me, it's an honor to be part of this coalition right now and understand and know every story about you guys, about the patients. For me, is the first step for my next journey. My first journey was to be a cheerleader, and just finished 20 years ago. And right now is fight with this disease and try to give the opportunity to all people to understand better about bladder cancer and other cancers. Whatever cancer, come here and fight with them. So thank you very much.
Thank you, Oscar, for such an amazing and active presentation. I loved it.
I hope we donate. I'm just waiting the money. Okay, let me check.
The last presentation is going to be online with Charles Ogada, which is the team manager of Desert Scorpion. Hello, Charles. Can you hear us? Hello?
Perfectly well, I can hear you. Hello?
Hello, can you hear us?
Yes.
Perfect. The floor is yours. Thank you very much for joining us online.
Okay, thank you very much. Hi, everyone. My name is Charles Ogada, and I'm from Kenya. I'm here to represent the Scorpion FC, which is the military team. And one thing I want to say is that the fight against cancer is deeply personal to me. It's the disease that took both my grandparents and left my family facing the heavy aftermath of medical debts and heartbreaks. And so from the painful experience, I made a promise to myself. I'll fight cancer to death at the end of the day. So in 2025, I took a major step towards the mission by joining one of the largest cancer communities in the world, and that's the World Bladder Cancer Patient Coalition. Their support gave me strength, the vision, and the courage to turn my pain into purpose. So earlier this year, in May, through the Scorpion FC, we launched a bladder cancer patient awareness campaign that reached across our leagues and into the hearts of players, fans, and families across the communities. We discovered something alarming. Bladder cancer is a slow and silent disease that many people know very little about. Too often, the symptoms are ignored and patients don't know where to turn for help. But through football, we found a voice. We use sports, the language of unity, to spread awareness in our community. And I'm proud to say that in our social health authority, which is the insurance for people, citizens here in Kenya, cancer patients now have access to free cancer care treatment. That gives us hope and reminds us that we can achieve when we come together. And I'm deeply thankful for the World Bladder Cancer Patient Coalition for their support, for opening our eyes, and for reminding us that every action, no matter how small, can save a life. Yet my journey doesn't stop here. Through the digital platform I developed for the Football Kenya Federation, I'm now working to create a system where small percentage of every transaction goes towards cancer patient support and youth empowerment. With the power of community and sports, and with the support of all 47 counties in Kenya, I will continue to push forward to ensure that every cancer patient in Kenya is cared for with dignity, respect, and love at the same time. Together we can build a stronger, kinder, and a healthier future. A future where no one fights cancer alone, and a world where we can finally say we beat cancer. So guys, thank you once more. And I'm sorry I did not make it in Belgium due to some avoidable circumstances. But since morning I've been here and I've gained a lot of knowledge about cancer. So thank you very much. May God bless you.
Thank you very much, Charles. And we also miss you here in Brussels, but thank you for joining online. We're going to move to the next session. Unfortunately, we do not have time for questions, but we do have a networking session later. So please, if you have any questions to the participants, if you have any questions if you have any questions, please do not hesitate.